The purpose of this show is to guide you to realign with habits that get you to live the life you've always dreamed of. This is the Habit-Based Lifestyle Podcast with Jesse Ewell. This is the Habit-Based Lifestyle, where you can access your full potential right now. Finally break free from destructive habits. That dream life, if you want it, you can have it. This is where you transform your health, mind, business, and relationships. Or do nothing and keep your life the way it is. But if you're ready for change, you're in the right place. This is where you're gonna learn how to live a habit-based lifestyle. You are tuning in to the Habit-Based Lifestyle Podcast with your host, Jesse Ewell. This is the Habit-Based Lifestyle.
Welcome back to the Habit-Based Lifestyle Podcast. I'm your host, Jesse Ewell, and today we're going to be talking to Dr. David Steenblock. He is the owner of Personalized Regenerative Medicine, and he also has a private practice that goes under his name, Dr. David A. Steenblock, and he's actually really helped me with my help, and his clinic has, and I wanted to bring him on as a special guest today. Because I think he's got a lot of valuable insight to share. So thank you for being on the show, David.
My pleasure.
So let's, can you give the audience a little 3-minute intro, just kind of about, who you are, what you do, and then we'll get into kind of the rest of the episode. Maybe just introducing, some of the medicine type stuff you've done.
Well, start with, I'm an Iowa farm boy. I did my first, helped do my first autopsy at the age of 4. Nobody believes that, but I did. I started getting into anti-aging at about that same age, 4 to 5, and started thinking about what can we do to stay young and healthy and avoid death and disease. And so from then on, I started working on that whole concept and went on to get my master's in biochemistry and my doctorate degree. And I did 4 years in anatomical and clinical pathology so I could understand the basics of death and dying. And then by knowing that, how to reverse and stop it and whatnot. And from then on, I got into chronic disease management, because that's where it all comes down to, is as you get older, you get chronic disease. And so I wanted to see and learn how to manage people with chronic diseases and how to stop it and reverse it. And so I've spent the last 50 years studying and treating people with chronic diseases. And I pioneered in a variety of different alternative therapies and have some battle scars to show for it. But I'm here now practicing medicine in San Clemente. It's now, I started practicing in 77 here, 78, and I've been in the area since then. We're down here in south, right off of by Walmart in San Clemente. It's a great place. So we have about 15,000 square feet and offer a variety of different things, including hyperbaric oxygen, and it goes on and on about all the different therapies we have to offer, including stem cells. And I've been pioneering stem cells for the last 20 years, and wrote the first book on umbilical cord stem cells, and continue to do research on stem cells and treat many people with stem cells for a variety of conditions.
Yeah. So, I mean, you got a long history of things that, that you can talk about. And I really wanted to take an opportunity to say, number one, I can relate to, being younger and kind of always looking at, hey, how do I really optimize my life, my health? Unfortunately, I learned kind of an unnatural way to do it when I was younger, and probably not the best way. But at the time, it was the best way I knew how. And sort of for me along my life, I've been able to work with professionals like yourself to where I get to go to your clinic every single week and have some of the therapies that you talked about. Many of the clients that I work with actually do too. But can you take us back to, you being an Iowa farm boy and just kind of how you fell into this? I know you mentioned, hey, at 4 years old, I did this, but can you kind of talk about how you fell into this?
Fell into being a doctor?
Yeah, like just your experience as a child, like, like you said, thinking about life and death, and like how do we how do we survive that? Or how do we even, think about that? Because for some people that's hard.
Well, I don't know how you can. I don't think I had any specific things. My mother was quite instrumental in my development. She was into taking care of the chickens and the cats and the pigs and whatever. We had all kinds of animals, so she acted like a veterinarian, and I learned from her how to handle taking care of animals as well as crops and growing things and all that. But basically, I just decided to dedicate my life towards science and trying to understand the whole situation as to what goes on with the human body. The first autopsy I did was a horse, and I had already learned how a tractor worked, and I knew about engines and pistons and all that, and I'd figured that out. My dad had showed me, and I had then wanted to compare the two, and so that was why I got interested in the horse, was because I wanted to see if there's some kind of relationship between a horse and a tractor, and we still use that comparison with the human body and cars and motors and all that. How if you don't have the right fuel, your engine doesn't run right and all that. So I think the practicality of it all is comparing an automobile to your human body. I think for most people that people can relate to that. And of course, as any young teenager, I became a automobile crazy and got into fine tuning cars and tearing cars apart and engines and all that kind of thing. So I was ordinary kind of guy.
Okay.
In terms of that, and got into trouble as a young hoodlum, and long hair, and engineer boots and a black leather jacket, and Elvis Presley. So
nice. Yeah. So when did you know? At what point in your life did you know? Hey, when you were younger, I'm going to be a doctor.
Oh, that was right away.
Okay.
Yeah, at 5, I'm sitting there saying, well, what do I want to do, in life, and I knew, and I had some experience with, well, I guess it wasn't 5, I was more like 7 at that point, 7 or 8, because I had already experienced with some doctors in town, and they were always clean, had clean hands, and Iowa farmers don't have clean hands.
Right.
And I kind of gravitated toward cleanliness for some reason. I was into clean everything, and I was always cleaning my house and the bathroom and other things, and the barnyard, mostly the chicken.
Okay.
Yards. I'd cleaned everything. My job was cleaning.
Nice. Yeah, and I can't imagine any farmer that's clean, that at least works on the farm, because
Right. So anyway, the point was that I tried to decide, well, what kind of a career do I want? And I wanted to follow in a career where I was clean and my hands are clean and I could work in medicine. And so that was a doctor. And these guys were the respected people in town. They made more money than everybody else. They had nicer cars, et cetera. So that was another motivation.
Okay.
So I said, well, look, this is a great profession, et cetera. Why not? This is what I'm interested in. So let me go into that. So from then on, I started, working on, not all the time, but I would start reading, and I started reading. And I became a great reader. I read more than probably anybody else in the history of my school. Yeah,
and now you have a big I actually got to see your library. I was like, man, this guy's serious. I thought I read a lot of books.
Yeah,
and
I've got the largest, I think, private medical library in the world, which is over 1 million scientific papers and 60,000 medical books. So it's quite stupendous, really.
Yeah, I was impressed, and I actually seen quite a few books that I had in your place, so that made me feel good that I was on the right track. I don't know if I've read mine, but I seen them.
Nobody can read all of that, no matter what.
Yeah.
So you have them there for reference, and when you're looking up things, you can have it all right there, so you can find, what you name a problem, and I can go to my library and say, okay, let me pull everything out, and I've got everything pretty much right there about your condition, so I can identify what you have wrong with you, and I can figure out what to do about it fairly quickly.
Wow. Yeah, that's amazing. And what's really cool to me is that you knew at such a young age, hey, this is what I want to be. And and let's be honest, like back then there wasn't Amazon, there wasn't, computers, there wasn't all these things. So there was really only one way you could get information, and it was pretty much through a book. Nowadays you could watch, stuff on YouTube, you could, listen to a podcast, but, there was only one way. There's no computers or anything like that. But so what was the transition from you, being a teenager to going to college? Where did you go to college and become a doctor?
I went to Iowa State University and majored in zoology and chemistry. In my third and fourth year, I got a National Institute of Health undergraduate scientific research grant and worked on research. Then in zoology, I worked on neuromuscular synaptic transmission and its effect, how it's affected by cold. And so that was an interesting field. So basically that was how the synapses in the nervous system work. So I worked in that. Still, to this day, I still work in that area to some degree. Medicine is so all-encompassing. You have to know many things about many things,
right,
to really understand it all. And even no matter how you study and how much you study, and day and night, night and day, 7 days a week, you still don't know it all. So
yeah,
it's humbling to say the least.
How many systems are in the body? If we just looked at, okay, how many is there, like muscular, vascular, and all these systems are kind of like intertwined with each other. And I kind of compare it to, guys who do personal training is like, hey, what's wrong with your knee? Well, let's look at your knee. That's a traditional model of like reactive medicine or reactive recovery, where if you may go to somebody else, they're like, well, if this is going on with your knee, it may be your hip, or it could be your ankle, which could be attached to your head, which could be attached to your toe. All of a sudden, it has nothing to do with your knee. And I'm guessing that's a little bit like medicine is, we always kind of focus on the thing, maybe, a liver or kidney, but really that is exposing something else somewhere else. And I'm guessing what you've done your whole life is kind of trace, okay, well, if this is going on, then it might be this, or it could be this. And
well, that comes down to like, sometimes I have patients that come in, they've seen 10 or 20 different doctors, and they've got 10 or 20 different answers, and none of them are right.
Right.
And so they give me, 50 or 500 pages of information, and I have to sit there and wade through it all and listen to their symptoms, et cetera, et cetera. But once in a while, I hear it all, and you take this piece and that piece and this piece and that piece and that piece and this piece, and you put it all together and say, aha, all of those pieces fit this.
Okay.
And absolutely everything that this person is talking about turns out to be related to one particular condition. And by God, it's almost always right. If all the pieces fit, you got it. But what happens is most doctors, you get 3/4 of it. And you say, well, it's probably that, and it's wrong.
Right.
3/4 of it is not enough. You need almost every kind of clue that you can get, and they all point to the same thing. You can be pretty assured that that's what it is, but otherwise you have to be, maybe, and then you have to try. Well, it sounds like this, so let's pretend that it is and treat according to that, because you don't have any other thing. So you try. So that's where the art of medicine gets into, is that you have to try sometimes because you don't know for sure about certain things.
Sure.
Like I got a patient right now who's old and falling apart, COPD, et cetera, and he looks like he may have cancer. All of his markers come back looking like cancer, but does he have cancer? And so I say, I don't know. I'm not sure. And so I've got test markers that say he's got cancer, but not so sure. I'm just going to treat it as if he'd just got an infection and watch him. And so,
okay.
So that's what I do. So actually, for the last 2 weeks, that's what he's done, and he's done nothing but thrive. And so he most likely doesn't have cancer. So I didn't have to send him off to an oncologist and think about all the rest of it. So he's getting better just because I was cautious and just said, let's just do what we can to heal your lungs and heal your body by lots of things.
Okay. So, what I always look at, guys like yourself who are kind of on the cutting edge of, medicine and what they're doing. And it's almost like you don't take no for an answer when it comes to, a patient or a client. that, hey, you're going to do whatever you can to figure out what's going on with your patient because,
That's a challenge.
yeah,
If I don't face each one of you patients as a challenge, that it's my job to identify the problems and then help you fix them, then I'm failing you and I'm failing myself because that's my job.
right.
So I really go after trying to identify exactly what all is going on with the person.
Yeah, and that's one of the things I really respect about you is that traditional, doctors, traditional medicine, I guess you go to a doctor and, it's like, why would you go to a doctor if they didn't tell you there was something wrong with you? And so you kind of go to a doctor because you want them to tell you there's something wrong with you.
Hey, how about this one? I think it's all in your head.
Yeah. Yeah. Well, I
You
mean,
get that a lot. You get
yeah,
that a lot. People, from the doctors, they don't know doctors don't oftentimes know what the hell they're doing.
right.
And so they'll just say, well, since I don't know anything.
It's all in your head.
It all sounds crazy. Like, for example, ochratoxin. Ochratoxin is like a mycotoxin. It's the strangest damn thing ever. The symptomatology is crazy. And it's like, what the hell are you talking about? You can't have something as bizarre as all these symptoms that you're describing. And yet, mycotoxins are like that. There's so many strange things that, we don't get very many cases of ever.
Right.
And if we do get them, we don't recognize them, so we send them to the crazy place.
Yeah. So when you first graduated being a doctor, obviously, this term of, kind of like, functional medicine, advanced medicine, and,
that wasn't invented at all.
yeah. So what were you doing when you first came out of,
We were trying to escape the long arm of the law.
okay. Yeah. So I heard,
We have, for example, I was in Sacramento at the time, back in the day, in like 77 or so, and here's a nice, friendly vitamin store owner-operator, and he advises some little old lady that, lady, you want to prevent a cold, why don't you take some vitamin C? And they arrested him for practicing medicine without a license and put him in jail.
wow. Okay.
Oh my God. And you say, oh, okay, maybe I better watch out telling people about vitamin C. I mean, vitamin C,
Yeah.
I mean, that's exactly what it was, and that's the truth. That's how bad it was in those days, was that anybody that, we had, and there's reason for that. Those of you who are younger than I am, which is probably most everybody, I'll tell you the history a little bit of American medicine, and that is that back in about 1950, we had the discovery of a new kind of medicine. It was a miracle drug, and that was antibiotics. It really started in the early 40s, but in general, the public never got aware of it because we were too involved with the war and recovery from the war. But in about 1950, Look magazine, Life magazine, Reader's Digest, etc. They started writing article after article about the miracle drug, one miracle drug for one disease. And they were teaching us that if we found out and identified the disease that you have, we could identify a drug that would cure you. And that became the mantra of modern medicine. And it continues to this day to some degree. And so, unfortunately, that turned out to not be correct.
Yeah.
But it has led a lot of people astray in terms of this way of approaching medicine. And the doctors are especially bad because the American Pharmaceutical Manufacturing Association, the FDA, and the AMA, those three, have been in a conspiracy between the three of them to help promote the use of drugs versus vitamins and minerals, etc. And in fact, I happen to have a copy of the agreement between those three companies in 1988, where 1998, I think, and they had put together $200 million for advertising for drugs and vitamins and minerals and,
Wow.
and holistic medicine. So there's been and we have the Quackbusters, which is another group that is internet. You go on the internet and put in Quackbusters, you'll find my name and all kinds of bad things made up about me. But the point of it is that all of it is fake. We
Right.
talk about fake news, our great president puts out
Fake supplements.
everything's all fake. What's fake is the fact that drugs are good for you. What's fake is the fact that these people have a conspiracy going to make sure that they keep on making money on the backs of poor people like you and me.
Right.
And that is a real problem. And unfortunately, it's going to keep on going, but
As long as money's involved, right?
right. And so, and we as the public are getting, another conspiracy is insurance companies, because insurance companies pay for the drugs, but they don't pay for their supplements and all that, because it's hard to know whether or not taking a supplement is going to do any good as such. So because they're more gentle, more healing as compared to like hit it in the head and kill it kind of thing with an antibiotic.
Right. Yeah. So, one of the things that I know about you was back in, I don't remember where it was it the early 90s, late 80s, where you had taken the California, Supreme Court for hyperbaric oxygen, hyperbaric chambers. And, maybe one of the reasons why that exists still today is because of that happening back then. But what was that like?
Traumatic. Basically, they went after me for using hyperbaric oxygen for the treatment of stroke. I was the first guy that came out and using high pressure oxygen to reverse the ischemic penumbra, which is an area around the central core stroke area that's been killed in a stroke. The brain, part of the brain has been compromised or killed by a blood vessel that has burst or a blood clot, and that area then has a surrounding area which is lacking oxygen, but it's still alive. That's called the ischemic penumbra. And if you do hyperbaric oxygen on a daily basis, you can revive that. I came up with that concept and how to treat and all that, and started to do that. And I had great success, and people still to this day are doing it because it is a successful way of treating stroke. But the problem is that you have to do it every day for at least 40 to 50 days, and that takes a long time. And so when stem cells came into being in about 2000, I got involved with that because I wanted to improve my results for the stroke patients who had been going through hyperbaric. They would tell me, I'm much better, but I still would like to get even better. Do you got anything else? And so I said, well, let me look into it. So as I looked into it, I found stem cells, started adding them, and found that within a couple of 3 years that stem cells could replace mostly the use of hyperbaric oxygen in many cases. So we hardly do any stroke patients with hyperbaric oxygen now. I can't remember the last one that we've done, but we do many patients with
stem cells. Okay.
And you can do stem cells in all kinds of different ways with stroke. So, and you can use it in combination with growth factors, et cetera. So, there's and diet. So you have all kinds of ways now of treating injuries that we never had 20 years ago, 30 years ago.
Yeah, I mean, stem cells is in the last like 5-6 years, at least in the community, biohacking, things like that, it's gotten more and more popular. But I know that's a big thing nowadays. But what, you didn't talk about, going to the court or whatever, going to court with the state of California with hyperbaric. But what happened, with that? Were you doing a treatment where at the time they're kind of like, hey, are you giving people vitamin C? And, people were benefiting, or what happened with that?
Well, I was talking about it and advertising about it because it was working. And this was September of 1994. And September, I think, 24th of that year, the FDA said that TPA, tissue plasminogen activator, was now a legal drug for the treatment of stroke. And that same month, they came after me for using hyperbaric oxygen for treatment of stroke. So so you can kind of say, well, maybe since they now have a drug, they didn't have a drug before that, and I'm promoting a drug, which is natural oxygen.
Right.
That's what I'm promoting. But they're saying, no, it's not approved by the FDA, therefore it's illegal.
Right.
Can you imagine? I can't use oxygen for treatment of a patient with stroke.
Wow.
But you can use TPA, which is a drug that they shoot in IV that can kill you or whatever, But so at that point, they took me to court, and they closed me down. They came in and raided us, put guns to my wife's chest and said, this is it.
Wow.
And so after they did the raid. Then they put embargo notifications on the chambers. We had 6 chambers going, and now an embargo means that you can't use them. And so as far as I know, I'm the only guy in the country's history that's ever been embargoed. But whatever. But so after that, then we are then scheduled for court, and so and we're going into federal court because I have to people don't know this, but if you have a problem with the state of California, you do not want the state of California to judge you. And so if you go to standard court in California, municipal court or whatever, you're talking about a state court run and owned by a state judge.
Wow.
And so if you're dealing with an issue like this, you don't want a state court because the state is going to stomp on you. And now we have this as a federal court because it's FDA. So I'd rather have the FDA because then
you get a fair treatment.
Fair. So what happened was I'm going to federal court, and in the meantime, I gathered up, 25 different people who had hyperbaric oxygen, who had had a stroke, testifying that it worked well and they loved it and da-da-da. So I had all these testimonials, certified, et cetera. And I got like 25 or 30 or more doctors to certify also that it was a great therapy and it should be used, et cetera. So I had all this, I had about maybe a foot of information, if stacked it up, of testimonials. And so we gave that to the feds before the trial, and they took a look at that, and they had absolutely nothing. They had absolutely no papers.
Wow.
They had one paper and one letter from the head of the National Stroke Association, whose name was Fletcher McDowell. And Fletcher McDowell, MD, was a physical therapist and had a big operation in New York, and a physical therapy operation in New York. And the year before, he and Dr. Richard Neubauer from Florida, who was an expert on hyperbaric oxygen and had taught me how to use hyperbaric oxygen for stroke. He and Neubauer were in China lecturing on stroke. And when Neubauer got up and talked about the miracles that you saw with hyperbaric oxygen, it pissed Fletcher McDowell off like crazy. So when he came back, the state of California asked him about my use of hyperbaric. He wrote this nasty letter saying it was totally quackery. It was dangerous. I was going to kill people, et cetera, only because he was pissed off at Neubauer having had such great results.
Wow.
And so anyway, the point was that we got 3 days to court, before court, and the judge and the FDA said, no, we decided to let it go. And so they backed away and said we could go back to work, and basically we won our ability to go ahead. And now they just told us not to ever advertise anymore, but we went ahead and advertised anyway.
Sure.
Too. So it was a short episode there.
Yeah.
It was traumatic to say the least. It cost me lots of money.
Wow. And I'm sure you didn't get reimbursed for that either, did you?
No. It was about $1 million, I think, when it came down to the total loss.
Yeah. So let's talk about, stem cells. Like what is, there's a lot of people on stem cells, that are thinking about it. Like, what is the best thing for you to do a stem cell? You have the umbilical cord, or you have where they, draw it out of you. And you can get your own stem cells that way. But what are the benefits of those two, when it comes to doing stem cells?
Well, in general, if you have a body that's contaminated, full of heavy metals, infections, hormonal imbalances, lacking enough iron, or have too much iron, or anything like that, any of those conditions, they're going to interfere with your use of stem cells. They're going to interfere with your success rate, and you really should think about cleaning your body first. You should be, there's many naturopaths and other doctors, alternative doctors, who are more than happy to look into your gut as far as what bugs, bacteria, yeast you have there, what is growing, what shouldn't be growing, and help you get those cleaned up. Check you to see if you have autoimmune diseases. Check you to have you have too much iron, like I said. That's hemochromatosis. If you have all kinds of different problems that you could have that you don't know that you could have. So if you do want to really have a good regeneration of your body, you want to make sure that the ground that you're putting your seeds into is healthy. You want to make sure that the ground has got plenty of fertilizer and good water and good hydration, etc. And basically, the ground is your body, and so you want to do what you can to really optimize your own tissues before you get the stem cells. Now, once you do that, now the question is how old you are. So if you're really old, like probably over, and let's say you're a couch potato, over the age of 60, you're going to be more apt to not have good stem cells in your bone marrow than you are if you're younger. Or if you're a very active kind of person, you're out running every day, you run 2-3 miles a day, and you're 80 years old, your bone marrow still is probably going to be pretty good, and so you could use your bone marrow then.
Okay.
So there's most people.
It's not a simple question. In other words,
I think if you ask all the doctors out there about this, and they would not talk about how important it is for you to exercise and use your legs, because they don't understand the fact that weight on your leg bones is what causes the generation of stem cells.
Okay.
So I remember always John Wayne, when he had a picture of in the National Enquirer back in the day when he had lung cancer, I think it was, and he was trying to maintain his weight. And one of his tricks for maintaining his weight, he strapped like 5 or 10 pound weights on his ankles.
Okay.
And so he could run around with all these weights on his ankles. Well, I think if you put it around your hips, it's better. So if you put 5, 10, 15 pounds of weight around your hips and when you walk, that'll be better in terms of making your bones stronger and healthier, and the electrical activity that's generated by this stimulates. It has what is called a piezoelectric effect on the osteoblasts and osteocytes, mostly osteoblasts that make bones, so your bones are increased, and they stimulate the formation of the stem cells within your bone marrow. So the more you exercise with weights, the more your bone marrow is stronger, the bone marrow stem cells are stronger, and so you can use those bone marrow stem cells then to help heal virtually anything. So that is all natural, and you get great results with bone marrow stem cells because you can get so many if you have good bone marrow.
Okay.
If you don't have good bone marrow, then you may as well just go ahead and do umbilical cord stem cells because those are great, and you don't have and fat can be also very good too. So again, though fat is a surgical procedure, and you can wind up with some pain for a week, 5 days or so, and all that. So some people don't like to do that, and I can appreciate that, but they're all good. I think we tend to do more umbilical cord because it's so simple. You come in,
right,
get a shot, and out the door you go. It's so simple and so safe, and there's no pain, no nothing. It's just and it's less expensive than the bone marrow and the fat. Because the bone marrow and the fat requires
time intensive.
Yeah, we have to have nurses, we have to have this, we have to that, and it takes a couple 3 hours to do, and so it's quick. It's a lot more time involved and more effort, and so we wind up charging 2-3 times more money for that. But they're all good.
Okay. Do you take stem cells and do them as treatments like every quarter, every 6 months, every year?
Well,
whenever you feel like it.
I feel like it. I'm working on like a more comprehensive, what's the diet supposed to be, what the supplements are supposed to be, what other things can you do to really activate it, activate the stem cells and all that. For example, in my office, I have what I call a stem cell redo, which is you come in and it's very simple. I don't know if you've done it, but it's a bed you lay on. We have magnetic pads under it. We have you breathing oxygen at high altitude for 5 minutes. Every 5 minutes, you're put up at Pikes Peak for 5 minutes, and that lack of oxygen for 5 minutes stimulates what are called hypoxia-inducible factors.
Okay.
And these generate also VEGF, or vascular endothelial growth factor, which are all factors that make growth. These are growth factors that make your blood vessels grow, muscles grow, everything grows better when you're doing all of this. So and so we have that, and then we have pulsed electrical fields that go through your bone marrow that drags the bone marrow stem cells out of you. So a combination of all these lasts for about an hour. So there's no needles and just pads and electrical stimulation. And so, but we can generate like 40% increase in your stem cells,
wow,
circulating stem cells by just these simple kinds of techniques. And so, for example, that hypoxia machine, the intermittent hypoxia, is useful for like bronchitis and asthma. And I've treated people with chronic asthma, bronchitis, and literally cured them. And it's just it's quite the tool, and it's called also ischemic preconditioning. There's thousands and thousands of papers written on it, and it's also called adaptive medicine. And so there's actually associations that are involving doctors all around the world that use this kind of technique for helping, just like Jesse here, you go into your gym, you work out, that's adaptive therapy. You're adapting your body to handle these different therapy
Right.
requirements that you're doing. You're lifting, you're doing whatever, and that's making your muscles stronger. And this is the same kind of thing that we're doing in medicine, is we're doing adaptive medicine. So most of the therapies we have are adaptive. It helps you become stronger and healthier.
Right. And I got to be honest with you. I have an oxygen machine. It's called Livo2, and it's for adaptive contrast training. So what it does is, takes away oxygen, and then you turn it back on and it pumps it back into your system, but you do intervals on it. But, the concept is very similar to what you talked about. But since I've been doing that, and since I've been coming into your therapy, doing the MAH therapy, the UVI light, and even the HOCAT, I was a kid that had asthma growing up, a lot of hay fever, stuff like that. I have no issues.
There you go.
And I used to get pneumonia for about a 7 or 8 year period. I got pneumonia almost at least once a year, and I have not had that either. And
yeah, it'd be interesting to see if anybody's done a study. So, with preventing COVID, pneumonia, and all that with this.
right.
I haven't seen it, but
Yeah, so let's get into
yeah,
COVID.
sounds like it.
What can you talk a little bit about, COVID and, people, there's a lot of things going around. Is it serious? Is it not serious? Yes, a lot of people have died, but like, is this, something that we really got to worry about going forward, the rest of the year?
I believe it's very serious. I've been saying that right from the get-go, and if people would listen to me, we'd be out of this already. But, basically everybody's got to take and bite the bullet and stay home and whatever you got, keep it, because, right now you could be infected and you don't know about it until tomorrow. Well, in the meantime, how many people have you talked to?
Right.
So right now I'm contaminated because I talked to you, and how many other people, because you don't know. As far as you're concerned, you're healthy. And then tomorrow, tomorrow, the next day or whatever, or vice versa, I could have it. So you don't know. And that's a real problem for everybody. And then of course you can tell yourself that it's not going to bother you, but how many people have said that and now are dead? Right.
And so we have 170,000 people.
Yeah, and it's just getting worse instead of better. So
right.
Maybe leveling off a little bit. The point of it is if everybody wore a mask, stayed home for 2 weeks, all of it would burn out because you're not passing it around. And if you don't pass it around, you're not going to carry it. People are going to stop getting it.
Right.
We're going to shut it off, and we're not going to have it then. So it has to be maybe 3 weeks, I would think. Maybe even if I were in charge, I'd say, let's do a whole solid month and be sure we got rid of it. And we do that, and we're going to be down to just a few cases immediately. So we're going to save probably, if we just think about how many people we're going to save over the next 4 to 6 months doing this, we're talking probably 300,000 people we're going to save if we do that.
Right.
300,000 people is a lot of people. That means that here around us, we're going to, 1 or 2 people that are going to be gone.
Sure. Yeah. And I've gotten into quite a few arguments of like, hey, we did stay home for, a good 6-8 weeks. I think the hard part is, you're a business owner, I'm a business owner. And, at a certain, depending on like who you are, where you're at, it's like some people, they can stay home. Can everybody stay home? And then are we at the point now where people are actually going to listen to stay home? And that's where I think we've kind of passed that point of people listening to, you know what I mean? There's just...
No, I don't, because people are going to die.
So
you have to stop and say, really, it's so serious. everybody out there should stop and say, look, we're going to die. Literally, we could be dead tomorrow if we don't do this. We have to stay home. We have to wear a mask. We have to socially distance. All the things that everybody's been telling us to do, we have to do instead of this bullshit running out to the market and doing this and doing that. Every day I go down, like the other day on the 4th of July. The 4th of July, everybody's told to stay home and not do anything. Where's everybody? They're down at the beach, they're doing this, they're walking down the street, and absolutely nobody had a mask on. Nobody.
Right.
And you know what happened? 3 weeks later, we had this total upswing of cases, all from the 4th of July. You know?
Right. Yeah, but I think...
You look at the data, it's right there. Just 2 to 3 weeks after the 4th of July, just went whoosh, up.
Yeah, but I also think, 2 to 3 weeks after protesting, it did the same thing.
Well, that's exposure.
Right. So I guess what I'm saying is one is I feel like we're kind of past the point of, people have kind of lost faith in who's saying what to do. And that could be frustrating for you as a doctor who deals with this stuff all the time. But, when it comes to, Americans, they don't have, it's like, you don't know who to believe anymore because it's like, hey, I believe you because I trust you, but like you have other doctors who are saying other things, just do this, just do this. And, what's unfortunate is there's no consistency in what we're being told outside of, one side says one thing, the other side says another. So like, when do you see this going away, or do you see this going away anytime soon?
It's not going to go away. If everybody has your attitude, it's not going away. We're going to have this forever. We're not going to, it's not going to go away until something miracle. So like if we have a real vaccine that actually works, which is very doubtful.
Right.
What's going to happen? It's just going to keep on going because nobody wants to do this hard thing, which is stop and let it burn itself out because that's the only thing that really works. I mean, look at 1918 or whatever. Look at everything. And, and you don't have to trust the doctor. You don't have to trust me. Go to the internet and study yourself, for Christ's sake. Be a smart guy and figure it out. The point is you've got to stay away from people that have it. And if you do have it, don't give it to anybody else. That's the bottom line.
Right.
And you can say all kinds of things about that people don't believe this and that. Yeah, we got plenty of reasons not to believe anybody. All you do is turn
yeah,
on the
but
TV and
my point is this: is we did stay home for
not enough
6-8 weeks.
Yeah, I went down and I looked. I would during that time, everybody when I went to Costco, everybody there had no mask.
Well, that wasn't required for the 6 to 8 weeks.
That's my point.
Right.
It wasn't required because they didn't know what they're doing.
Right.
They didn't ask me.
Yeah. Well, so, I'm not. What I'm saying is it's kind of like we were told, masks, you don't have to wear them. You could go to the grocery store, but then now
I agree, they're all idiots.
It's different, and so it's hard as someone. Hey, I'm looking at other things, but like it's hard as someone even outside of me to be like, okay, well, who do I listen to? Because the doctor that I'm listening to doesn't know what they're talking about or won't talk about it, and so I think it's just hard because there's so many different people saying so many different things.
I think in general, everybody tells you that's got any brains is saying avoid other people, social distancing,
sure,
wear a mask. Those are the things that we should all be doing, but they aren't. I go, you're not wearing a mask.
Right, but I'm also in an office that's mine that no one else is in.
Right.
So,
but you tell me also that you're not wearing one no matter what. And so,
well, no, I wear a mask if I have to go to the store.
Well, so I'm just saying that there are lots of people out there, like on TV last night, there was some gun owner. He says, I don't let anybody in my shop with a mask on. They got to take it off. This is the kind of problem that we're dealing with. People have decided that it's to be
it's like a badge of honor.
Yeah, you're a real man if you don't wear a mask. Yeah, well, I'm a pussy. I wear a mask.
Well, here's what if I'm going to be around a big group of people, I mean, it makes sense. If I can be away from somebody, like I'm not going to probably wear one, because
no, if I go out exercising, I don't wear one.
Right. But then there's the other side of, well, does a cloth mask work? Does the specific mask not work? So,
well, you can always argue about every little detail in the world.
Right.
It's better to have something. So
sure. And I guess, what's been really frustrating is, the misinformation all the way around. Is it's like who do you trust?
Let's talk about something more practical.
Yeah.
And that is how the virus affects you, how it attacks you. First it comes into your nose and into your sinuses and your upper throat. And that's where it festers.
Okay.
So those are the areas that you first have to understand that's where the virus is. As the virus comes in, it starts to grow, and as it grows, it kills the tissue there, and then the tissue sloughs off, and you cough it out. And with that come pieces of your tissues with the viral particles. And these viral particles are about 100 nanometers, tiny little guys, but they themselves are toxic. Not only the viral particle itself, as it, because of its spike protein and all the different things it has to attach itself to the cells of your epithelial of your sinuses and whatnot. The fact is that the viral particle itself, without any other thing, actually can be injurious to your tissues. So any kind of particle that you breathe in is damaging to your lung and your sinuses, etc. And it makes the COVID worse. So if you happen to have air pollution and your air is polluted, and you have any of these little tiny nanoparticles in the air getting into your sinuses, etc., that's going to make your tissues more sensitive and more susceptible to the COVID and have the tissues break down. So what you want to do is have very clean air. So your bedrooms should have good, clean air cleaners. Your house should have a good air cleaner. You shouldn't be smoking cigarettes, and you shouldn't have any kind of air pollution around you at all. So you want to have as clean air as you can possibly get. Second is a little home remedy I came up with. You might want to write down. Quick, grab a paper and pencil, because you go to Walmart. Aloe vera, they sell aloe vera at Walmart for like $7 a gallon. Walmart, and you take that aloe vera and put that in your teapot, and you put green tea in your aloe vera hot water, and you turn it into green tea aloe vera with green tea, basically green tea made with aloe vera. Now that you can drink all day long, and that's antiviral. Both are antiviral. So you can also use that combination along with a little package of NeilMed, Neilmed, NeilMed salt packs. They come in boxes of 250 or so. You can get them at Walmart. You can get them at Costco. They're made for using to put in your.
Is that for your nose?
Yeah, for washing your sinuses out.
Okay. That's the I can't remember what it was, like a nettle,
right,
or
yeah. It's called NeilMed, and they have a squirt bottle. They got the salt packets and whatnot, and you can take those salt packs, and you can take one of those and put that in 8 ounces of this aloe vera green tea material, and that makes it so that it's smooth and easy to wash your sinuses out. Now you've got two antivirals that are being used to wash your sinuses out. Now,
okay.
So if you come down with any symptoms, you may as well just try to do that, because that would be very helpful for eradicating it and getting you through it all, and drinking it. So you drink it and wash your sinuses out. That's probably number one thing you can do to help prevent you from getting worse. Then, of course, you got your vitamin C to take and your vitamin D to take. And, if you haven't been on any vitamin D, I would say, and you come down with COVID and it's COVID and you haven't had any vitamin D for the last 10 years or whatever, I'd jump right on taking 50,000 units a day for at least a week, because you really want to hit yourself hard if you haven't been doing any. Now, if you've been taking 5,000 units a day, then, for the last year, hey, you're probably pretty good. You don't have to go crazy about it. Now, and then a little zinc is good too, supposedly with each meal. So 5-10 milligrams of zinc. Now.
So let me ask you this. If you could go outside before 10 a.m., without a hat on, or maybe a shirt, depending, as much skin exposed as possible, would that be a better form of vitamin D, or would you recommend
No, I think that those are good. I think about half an hour of that it would be good. Sure.
Okay. Yeah, that's one of the things that I've really worked on, is getting outside before 10 a.m. and getting 30 minutes.
Another thing that will help that nobody talks about is vitamin A.
Okay.
I'm a big believer in vitamin A and how it helps heal So vitamin A has been known to help epithelial tissues, the cells of the lining of your gut, the lining of your lungs, epithelium of your sinus, etc. So why not use, a fair chunk of vitamin A? And that would be at this point, when you got it, 100,000 units of vitamin
Okay.
K a day, and just jump on it and take it, because it's not going to hurt you whatsoever. People have taken 100,000 units a day for a year without any side effects. And
Okay.
so if you take it for a couple of weeks, whoopie-doo, it's not going to hurt you at all. So those are some real
Yeah, natural.
things that
Yeah.
you can do to get better.
Let me ask you this. What are your thoughts on, if you can give them, hydroxychloroquine, zinc, and azithromycin?
Well, number one, it's all the double-blind control studies say no. So there's, the only way for me to do it is I have to go back and read all the papers and look at each one and see who's telling the truth and who isn't, because right now we got total confusion.
Right.
We got the president
That's
saying it's great.
yeah.
We got 600 doctors saying it's great. We have, what's his name in New York, Zelensky or whatever his name is. He's cured 350 people, and yet when you go to his websites, et cetera, there's not one person that says anything good that he's done anything for him.
Okay.
So you go, wait a second. If I have 350 people I've cured of COVID, I would think one of them is going to put something on my website, say, Steenblock is a genius.
Right.
He used this and this and this, and I was sick as hell, and now I'm, within 2 days I'm cured.
Sure.
Not one word of anything. So you just don't know who's telling the truth out there. So if you don't know for sure, then
which is kind of my point on the whole thing, is that's what's probably the most frustrating for us, is like, okay.
Well, we do know remdesivir is much better than hydroxychloroquine.
Okay.
That works like a champ, but
It's much more expensive.
Yeah, but that's approved. FDA approved it. It's available. Why not use it instead of hydroxychloroquine, which the pharmacy board is saying if you prescribe it, will try to take your license away even. That's how serious they think it is.
Okay.
And they think it's all quackery. So the scientists in us, around us, are telling us that don't do it because it's not worth it and it's dangerous. So.
But it's also been around for what, 50,
I've
60?
used it for years and years. That's
Yeah.
not the point. It's just that.
Just not maybe
It's
for this.
misdirected information.
Okay.
We have lots of other things to talk about that are better, like this stuff with the green tea. Whoever talks about green tea, it works.
Right.
There was this many years ago. I got into this many years ago, and they did a study back in the 60s, I think it was, and they found that people that drink coffee, if you look at the average lifespan of 72 years, the people that drank coffee died 5 years younger than 72.
Wow.
The ones that drank tea died 5 years later.
Which would be a lot of Asian population.
Yeah. So the point of it is green tea is healthier for you than coffee.
Is there a specific type you'd recommend, or just, hey, grab it and?
Maca it's a Korean green tea, MACHO, I think.
Okay.
Or MACHA. And that's the best green tea and should be the best for fighting the.
And you're saying that with the Neomed, vitamin C, zinc, vitamin A, if you feel like
the aloe vera from Walmart.
Yeah. Aloe vera,
Now the aloe vera from Walmart you can use for brushing your teeth too.
Okay.
Because if you have gum disease, it'll help clean up your gums and help heal. Aloe vera is one of the most healing substances we have, and yet nobody talks about it.
Right.
When was the last time you ever told anybody, aloe vera, man? Like, for example,
maybe a sunburn.
Cat scratch.
Yeah.
If you have a cat and the cat scratches you, I swear to God, you'll be totally amazed if you put fresh aloe vera on it. Within no more than 12 hours, it looks like there's been no scratch whatsoever. It's back perfectly normal. If you don't do it, it's like 3 days of hanging in there with a damn cat scratch. I swear, you try it. Anybody who's got a cat out there and you have a scratch, get some aloe vera and try it. You'll be totally blown away.
Yeah, I got no cats. But hey, if you guys are listening to this, I just want to point out one thing is, Dr. Steenblock talked about aloe vera, and then the neti, I think it's the neti pot, I'm pretty sure, and that's the salt, right?
No, neti pot is a special device. It doesn't work very well.
Okay.
Neomed,
that's what it is.
has actually a little plastic container that costs you $6 if you want to use that.
Okay.
You fill that up with, that's 8 ounces. You fill up with water and you put in 1 package of salt, and then you can use just that's salt water, and you can use that to flush your sinuses.
Okay.
If you don't want to use my little home remedy of green tea and aloe vera.
Okay. Yeah. So, and then I was going to get to the green tea, which was the maca, Korean green tea. So those are three things that will help keep you healthy, right? And then if you end up getting it or having some symptoms of it, then you'd obviously want the vitamin C, vitamin D, zinc, and vitamin A. Now, would you recommend taking those just as a precautionary thing, or would you wait till you had symptoms?
It comes down to your health.
Okay.
If you have any kind of medical problems, I'd say, yeah, you maybe should start taking
Yeah,
those
maybe
things.
you're high risk.
You're high risk. If you stop and think, well, who are people at high risk? Hypertension, obese, people who are overweight, heart disease, diabetes.
Asthma, somebody maybe.
Not so much asthma, a little
Okay.
bit, but mostly people with high sugar.
Okay.
High levels of sugar really contribute to it. It's involved with the advanced glycosylation end products that are being produced, and those suckers are detrimental to the tissues. And so basically you want to avoid sugars and eat. In fact, if you go online and put in Google, just put in diet for COVID, and you'll pull up a review article that's got about 15 pages of information about exactly what to eat.
Okay.
So I'd recommend
Wow.
strongly, if you can't find it, just email my office and we'll send you the link.
Maybe we come out with a new diet program called COVID.
Yeah, the problem is, I don't think, it doesn't seem like anybody's really interested in facing this from what I can see, because I put out on my Facebook is David Steenblock, and I put out, would anybody want to have a dietary plan put together for them, a supplement program for them to help prevent the COVID problem or face it and all that? I get absolutely no response.
Yeah, well, I would say that that's not because nobody wants to do that. That may be a different issue of, maybe we're just not posting enough and people aren't seeing it. But I could promise you, if I put that out, you would get a lot of feedback from that. So let's.
I'll be surprised.
Okay, well, let's see what we can do.
I have not been impressed by the American public as far as taking care of themselves and being
Sure.
in charge of their own problems.
Well, I think it's kind of like we talked about earlier is, health hasn't been a huge priority to the American public,
Right.
and it's really getting exposed now or
Right.
the last 4 or 5 months more
Right.
than ever.
Right. I mean, if you go back and for the last 30 years, the FDA and all kinds of the AMA, et cetera, have all been saying we're overweight. All of us are eating too much sugar, too much fat. We got to change our ways. Right?
Right.
Then nobody did it.
Right. They
Nobody
got
did it.
worse.
Yeah. Everybody's
So
just
let's-
gotten worse.
yeah,
instead
let's-
of getting better. And so
Yeah.
here we are in a situation where you die if you don't pay attention, and
Right.
people are still not paying attention.
Right.
See, so what do you have to do? I mean, that's a real problem.
It's unfortunate. And what's really unfortunate is, where we look and get information. And that's, what I think, I think if we have more people like yourself who are coming out, speaking about this, kind of doing what we're doing now is like, hey, let's find some alternatives to what we can do to protect ourselves now, going forward. I think that's kind of the right path and the only path we can really go down now.
True.
So,
Amen.
and hey, I really, number one, I want to thank you for what you do, what you've done, what you've been through as a doctor, your clinic, but also just the knowledge that you bring forward and being on the cutting edge of medicine and being a doctor. And I think that's really amazing. So I just wanted to say thank you for coming on the show today.
Thank you for having me. I appreciate it.
Yeah. So if you guys are looking to, maybe want to discuss some of these, these alternative, ways to keep from getting anything, not just, COVID, but anything, I highly recommend Dr. Steenblock. He's at Personalized Regenerative Medicine. If somebody wanted to get in contact with you from this show, how would they do that?
I just, they can look on my website, which is stemcellmd.org,
Okay.
stemcellmd.org, or give us a call, 949-367-8870.
And if you guys are listening to this and you want a specific example of what he recommended, I'll make sure I put attach that in the show notes, and we can send that to maybe a PDF for them just to see. And I'm going to do some posting on Facebook and see what happens.
Great. Appreciate it.
All right. Thank you, guys. If you're looking to connect further with a group of like-minded people, join myself and so many others in the Habit-Based Lifestyle Secrets group on Facebook, where we will be talking about habits, hacks, and other things. Until next episode, have a great day.
The purpose of this show is to guide you to realign with habits that get you to live the life you've always dreamed of. This is the Habit-Based Lifestyle Podcast with Jesse Ewing.